Polycystic Ovarian Syndrome, or PCOS, is a common syndrome. It occurs in about 13% of women, even more in Indigenous women. It's fairly common. It's caused either by genetics, so sometimes it can run in families, sometimes it can be due to lifestyle issues, but we do see it quite frequently here at the clinic. There are 3 criteria to diagnose polycystic ovarian syndrome, and to have the concrete diagnosis you need 2 out of the 3 criteria. The first criteria is around periods. So often women with polycystic ovarian syndrome present with irregular periods. So it may be that their periods are coming more frequently than every 4 weeks, or it may be that they're coming infrequently. So they may come every couple of months. So that irregular period is the first criteria. The second criteria is having ovarian cysts on a pelvic ultrasound. So when we're investigating for irregular periods, we might be thinking down the line of polycystic ovarian syndrome and order a pelvic ultrasound. And often on the pelvic ultrasound you can see tiny little follicles around the ovaries that we call polycystic ovaries. The third criteria is an expression of testosterone. It may be that women present with sort of severe acne or hairiness in unusual places, such as on your face or chest, on your abdominal wall, shoulders. That can be an expression of what we call hirsutism or hairiness. Sometimes women don't have any of those features of acne or hairiness, but on their blood test, on their hormone test, they have an overexpression of testosterone, which we all produce as women, but there can be an overexpression of that. To diagnose polycystic ovarian syndrome, you need 2 out of the 3 criteria. So it may be irregular periods and the polycystic ovaries on the ultrasound, or it may be irregular periods and the testosterone imbalance. So 2 out of 3 things. The guidelines for diagnosing polycystic ovarian syndrome changed just around diagnosing in young women. So women who are within 8 years of their first period, an ultrasound is not so reliable in the diagnosis of polycystic ovarian syndrome. So what we rely on when we're diagnosing polycystic ovarian syndrome in young women is the irregular cycle and also the testosterone imbalance, or acne or hairiness. Just in a nutshell, the issues can be around managing your irregular cycle. So if your periods aren't coming very frequently, it's important to have a period at least once every 3 months. So we can talk about options for management there. The oral contraceptive pill can be one option, which is quite useful. If you didn't have a period every 3 months, then the lining can build up inside your uterus and become atypical and irregular. So it's important to manage periods. The second issue around polycystic ovarian syndrome is around, it may be around acne or hairiness. So again, we can provide some assistance and some treatment for that when we talk through management options. The other issue that often women ask about is fertility and polycystic ovarian syndrome, and I think it's really important to bear in mind that most women who are planning a family do achieve that family, even with polycystic ovarian syndrome. About 30% actually can spontaneously fall pregnant without assistance, and the remaining 70% may need some assistance to fall pregnant. So come and talk to us about that, but if you are not wanting to fall pregnant at this point in time, it is important to use contraception to avoid an unintended pregnancy. Some other issues around polycystic ovarian syndrome can be around weight change. So women can gain weight with this syndrome, and it can be difficult to actually shed weight. We try and target staying in the normal weight range, and you may need some referral to an exercise physiologist or a dietitian to assist with that. So it's really maintaining a healthy lifestyle and a normal body mass index. And that can also help with regulating your periods as well. So often periods can become regular with a normal body mass index. And the last thing around polycystic ovarian syndrome can be a predisposition to developing diabetes later on. So we do like to keep a close eye on your sugar levels and your cholesterol. It doesn't mean that you're going to develop diabetes, but there is just a predisposition to developing that. And also gestational diabetes if you're pregnant. So we just keep a closer eye on things. So the other issue, there has been a link between anxiety and depression and polycystic ovarian syndrome, and sometimes self-esteem issues. So, we will address those when you come in to talk to us at Clinic 66. And we can also provide you some information around that as well. So if you think you might have polycystic ovarian syndrome, or have irregular periods and you're wondering about polycystic ovarian syndrome, please feel free to make an appointment. Appointments can be made online, or you could phone our reception staff and make an appointment. The testing that we would undertake is our blood tests, as well as possibly organising for you to have a pelvic ultrasound. So in that process, we would exclude other causes for your symptoms, as well as diagnosing polycystic ovarian syndrome. So make an appointment. We're here to help you and answer any questions that you may have.